In a pregnant uterus, the placenta supplies oxygen and nutrients to the fetus and carries away carbon dioxide and other wastes. Attached to the placenta is the umbilical cord, which carries blood back and forth between the fetus and the placenta. The fetus and the fluid surrounding it are contained within the amniotic sac. Suction curettage is the type of procedure most frequently used to accomplish abortions in the first trimester. This procedure begins with the insertion of a speculum, which enlarges the opening of the vagina. After painkillers, normally lidocaine or xylocaine, are injected around the cervix, a sharp grasping instrument called a tenaculum is locked onto the cervix and pulled until the uterus is brought in line with the vaginal canal. In order to accommodate the instruments necessary to continue the abortion, the cervical opening is then enlarged through the use of cervical dilators. These dilators come in a range of sizes, and progressively larger ones are used to achieve greater dilation. In the procedure depicted here, 2 sizes are being used. Next, a hollow plastic tube called a cannula is inserted into the uterus. This tube is attached to a suction machine by way of a flexible hose. As the machine is turned on, the fetus, amniotic sac, and fluid will be sucked out of the uterus. Then, tongue-like devices called forceps are used to remove any fetal parts or tissue missed during this vacuuming process, including whatever remains of the umbilical cord or placenta. Once that's completed, a metal rod with a loop on the end, called a curette, is scraped along the inside wall of the uterus to dislodge any remaining tissue or placental matter. After that, the suction cannula is again inserted into the uterus in order to remove the tissue that was dislodged by the curette. When the uterus is empty, the tenaculum is released, and the uterus returns to its normal position. After the speculum is removed, the procedure is complete. For second and third trimester abortions, the most common procedure is dilation and evacuation, or D&E. Although the instruments used in a D&E are basically the same as those used in a suction curettage, the procedures differ in several important ways. First, because the fetus is considerably larger at this stage of pregnancy, a greater degree of cervical dilation is required. This dilation is accomplished in multiple steps, which means that most D&E abortions take more than 1 day to complete. On the first day, the patient's vaginal opening is enlarged through the use of a speculum. Then a tenaculum is locked onto the cervix and pulled until the uterus is brought in line with the vaginal canal. Next, the cervical dilation process begins with the insertion of a compressed seaweed product called laminaria. Before insertion, and it's not unusual for more than 1 laminaria stick to be inserted at a time, the depth of the cervical canal is measured with a thin metal rod called a sound. Once that's done, forceps are used to insert the laminaria and place gauze over the mouth of the cervix. The tenaculum is then released and the speculum is removed. As the laminaria absorbs moisture from the cervix, it expands and dilates the cervical opening. This process generally takes several hours to complete, but in the case of very late-term procedures, it can take 2 or 3 days. In some instances, subsequent laminaria installations are required in order to achieve the necessary dilation. After the stage of the dilation process has been completed, the speculum is again inserted and the gauze removed. The tenaculum is then used to pull the uterus back in line with the vaginal canal, and the laminaria is removed. Next, greater dilation is achieved with the same progressively larger cervical dilators used in the suction curettage abortion. Once the cervix is sufficiently dilated, a cannula is inserted and the amniotic sac and fluid are sucked out. Even though the cervix is far more dilated in a D&E than in a suction curettage, the fetus is so much larger that it must be dismembered inside the womb and removed in pieces. Forceps are used to accomplish this and to remove the remainder of the umbilical cord. After this process has been completed, a curette is scraped along the inside wall of the uterus to dislodge any remaining tissue or placental matter. Then, the suction cannula is again used to remove whatever tissue was dislodged by the curette. When the uterus is empty, the tenaculum is released, the speculum is removed, and the procedure is complete.